Hello, I'm Dr. Emma Richards from the Centre for Ageing and Dementia Research in Swansea University. I am extremely pleased to be asked to present some of my findings of my PhD research that examines reaction time and other measures in relation to ageing and vascular cognitive impairment. What is vascular cognitive impairment? Some of you may be more familiar with the term vascular dementia or vascular neurocognitive disorder, which is a newer term for vascular dementia. Vascular dementia has been afflicted with issues relating to definition, diagnostic criteria and nosology that have been modified and reworked many times. And it's these issues that have made research into the disease extremely difficult, especially in respect to comparing results from different studies that use different criteria or they're from a different point of time, in which the classification of the diseases have been updated or changed. Vascular dementia is typified by the loss of cognitive function to a degree that interferes with the activities of daily living. It typically results from ischemic or hemorrhagic cerebrovascular disease, and what this is either little bleeds within the blood vessels of the brain or blockages within the blood vessels. Or it may result from cardiovascular or circulatory disturbances that injure the brain regions that are important for things like memory, attention, cognition and behaviour symptoms, which can vary from person to person depending on what area of the brain is damaged. It is crucial to detect changes in cognitive function in vascular dementia specifically, and in healthy ageing, which might signal the onset of the early stages of the disease as early as possible. Many patients are unaware that memory may be relatively unaffected in vascular dementia in the early stages, unlike other diseases like Alzheimer's disease, where memory is a significant symptom. And people may miss the opportunity for early diagnosis. Being able to identify people at greater risk of developing significant cognitive and functional impairment in early vascular dementia can be challenging. This is because the onset of vascular dementia tends to be insidious or subtle. Research has shown that reaction time can be slowed in people with vascular dementia. The diagnostic manual that the clinicians use suggests measuring reaction time to aid with the diagnosis of the disease. In this study, we used a computerized visual search task because this allowed us to repeatedly measure somebody's reaction time, enabling us also to measure variability in people's reaction times, the errors and the effects of practice, and what happens if we put some distracting information, and what happens to people's reaction time. The aim of the study was to use a simple multi-trial visual search task, which we done on a laptop. We examined reaction time, inter-individual variability, which is the variability that somebody has when they do the task over and over again. We looked at their error rate and the effects of processing load, and we induced this by adding in distracting information onto the screen. We also looked at practice effects. We examined a group of young adults and compared them with cognitively healthy older adults, and this gave us a baseline of what it is like to age naturally in relation to your reaction time. We then compared the cognitively healthy older adults with a group that we matched for age who had vascular dementia. These images here, they're typical of the visual search task. Each participant was presented with 32 images with multiple arrows and 32 images of just one arrow. These were presented randomly. The task was to select as quickly as possible the only arrow that was facing left or right by selecting a button on a box to correspond to left or right. As we can see here, this is the target arrow that they need to find, because this arrow is pointing to the left. As you can see, all these other arrows are pointing up and down. Over in this box, this arrow is much easier to find because it hasn't got all these other distracting arrows. I'm going to talk firstly about some of the results from the young adults compared with the older, healthy adults. This will give us a baseline then to do a comparison with the vascular dementia group. Older adults had significantly slower reaction times compared to younger adults, both when there were distracting arrows on the screen and when there were no distracting arrows on the screen. And in fact, older adults' reaction times were more than double that produced in the younger group, and that was for both conditions. Young adults were significantly less variable in their reaction time performance compared to older adults. That was for when there were distractors absent and present on the screen. What this means, for example, is if a young adult had a reaction time of around 700 milliseconds, they didn't vary much from around the 700 milliseconds over the 64 trials. Whereas the older adults, whose reaction times were approximately 1400 milliseconds, varied significantly. So they may have had a reaction time of 900 milliseconds, then another of 1400 milliseconds, and another of 2000 milliseconds. When we examined error production, the errors were very low in this task, and the results revealed no differences in the errors made between the young group and the older group for any of the conditions. When we looked at practice, older adults were able to improve their reaction time when there were no distractors, unlike the younger adults. In the more complex task of when there were distractors on screen, both young and older adults were both able to improve their reaction time. In this slide here, we can see the distraction effect in milliseconds between older adults and younger adults. To achieve this and to work out the distractor effect, we took the mean reaction time when distractors were present and took away the mean reaction time when the distractors were absent. The blue boxes represent the young adults and the green boxes represent the cognitively healthy older adults. We can clearly see by adding in distracting information, older adults took longer to react. This is a table showing participant demographics. We have a column here with CH, which is cognitively healthy older adults. There were 26 participants, with the average age of the participant being 76 years old. In the other column, SI-VCI, this simply means subcortical, which is the region of the brain we were looking at, ischemic, which means that they had a restriction in the blood supply to the brain, and then VCI, as we know, is vascular cognitive impairment. There were 27 participants from Llandoch Hospital, and the average age of these participants was 78 years old. So now I'm going to discuss the results from the cognitively healthy older adults and the comparisons with those with vascular dementia. Reaction time and the variability of reaction time was significantly worse in those with vascular dementia, and that was irrespective of whether the distracting information was on the screen or not. This reveals the importance of reaction time tests and individual variability tests in diagnosis. In real life, distracting information can have a detrimental effect on the lives of people who have vascular dementia. Environments can be cluttered, and if objects are taken longer to process and continually capture attention, this can lead to things like trips or falls or difficulties in driving when there's multiple distractions around you in the environment. Within the vascular dementia group, there were some individuals whose performance was much worse than expected compared to the rest of their group. And it may be that these are the type of people who are most at risk of disease progression, or in fact, perhaps they're at a later stage of the disease than indicated by the MRI or the CT scans and the other test results, which is an important finding. Errors were low for both groups. However, those with vascular dementia made significantly more errors than the cognitively healthy older adults on both conditions. That was the distractor absent, where there was just the one single arrow, and the distractor present conditions, when there are multiple arrows causing distractions. Only in the vascular dementia group did distractor significantly increase errors. We did not see this in the cognitively healthy older adult group or in the young adult group. An important finding, providing evidence to include error production as part of tests for vascular dementia. We found practice did not affect reaction time, inter-individual variability or error production when we examined the distractor absent condition for either group. However, when we examined the results from the distractor present condition, we found that those with vascular dementia could improve their reaction time slightly, but could not improve their inter-individual variability or error production, providing further evidence to include not only reaction time and error rate, but also to include inter-individual variability and distracting information into future tests. Thank you so much for listening. I'd like to take this opportunity to thank all my participants for giving up their time and coming to take part in this research, and to Brace Alzheimer's Charity based in Bristol for the funding, and also to my supervisors. Thank you.